Hey everyone, Nick Favazza here. Going to show you an app I designed using LiveCode. This is Mini Project 5 for interactive learning environments at FGCU. And the app, right now it's just a Windows-based app. I did do it in the standalone version using LiveCode, so this is its own app. It's functional, it's not all-inclusive yet. There's a lot of data that has to be put into it. But just to give you a brief idea of what it's supposed to do, it's basically an app designed for education, both patient education and provider education, as a means to kind of speed up productivity, centralize all the information. One's medical information is very important to us in helping to reach a diagnosis. In addition to the physical assessment we do, we really depend a lot on somebody's history, especially recent symptoms, vital signs, stuff like that. So a lot of folks at home, they're taking their own vital signs and they keep a log of it, but then when we need that information, maybe that's misplaced, or medication list may be misplaced. So this is going to put everything in one easy to locate spot. For example, I'm going to log my vital signs. Let's say my blood pressure is 120/80, which is a textbook perfect blood pressure. You record it, it says vitals have been recorded. Now I come in the next day and my blood pressure is 140/90. I type that in, and what it will do is it'll determine what vitals are outside of normal parameters and provide education in this way. Just, you have hypertension, seek medical attention. Very basic right now, but just a way to provide some patient education as to what these vital signs mean. And the goal is to add, in addition to blood pressure, pulse rate, blood glucose for diabetics, and pulse oximetry, oxygen level for the COPD patients. Symptoms. This is a basic nemesis list of common symptoms. Hopefully this would be expanded out. I think it's a good basic list, but let's say somebody's having chest pain, which could indicate a heart attack. Some people don't know that. So I think the future development of this, once I click pain, maybe it'll populate another list saying where is your pain, and if it's chest pain, again, it would give that message. Maybe a quick video would pop up saying, chest pain could be indicative of a heart attack, and kind of tie it in with the risk factors they have. So we really want it to be interactive, but it is going to take some time to develop that. But let's just say pain, we save it, your symptom has been recorded. Allergies, again, it's not an all-inclusive list. These are some common allergies. Say I have allergy to penicillin and medications. So if I'm taking 81 milligrams of aspirin a day, had that and has been recorded. And then if somebody needs to go in here, and this is where it's going to help providers gain an education as to somebody's medical history. You see the vitals we recorded are in there, along with a timestamp. If we come over to symptoms, and keep a list of the patient's symptoms, allergies, and the medications that we recorded. So everything's very easy to locate. And then the future goal is to use all this and develop an algorithm taking into account age and vital signs and medications, everything. And it'll have a very easy to interpret bar chart with heart risk and stroke risk, so people can understand if they are at risk for that, and hopefully it'll encourage them to seek medical attention sooner. So again, on the provider side, a little bit of education into the patient, and on the patient side, a little bit of education into the medicine as to what this all means and what the correlations are that they may not necessarily understand, but just putting in the information will kind of kick it back to them and guide them in the right direction, whether that's seeking medical attention from a physician or calling 911. There's a demographic page that updates in real time. As you type it in, it'll save your information, confirms that it's been saved, and there also is a messaging feature which is defaulted to me as the developer right now, but future plans are to have this be able to send a message including your file to a physician or a medical provider. And that's about it.